guys, it's Khaki. Today I want to talk to you about the top 10 things to ask your bariatric surgeon before you have surgery. I know that before I went and talked to my surgeon, I had a list of questions that I wanted answered. So let's talk about what needs to be on your list before that first appointment. Number one, I would ask after they take your complete medical history, including your goals, what surgery do they recommend for you and why? There are certain things, certain conditions that make one surgery better for some people than others. For example, if you have acid reflux, the sleeve can actually make that worse. Some people actually develop acid reflux after a sleeve procedure who didn't have it before. Other folks who have a lower BMI, less weight to lose, the sleeve may be the perfect thing for them. The surgeon should be able to tell you, this is what I recommend, and this is why. Then the decision is yours to think about. The most important little nugget of this is to make sure that your surgeon is experienced in more than one kind of surgery. Are they just recommending the sleeve to you because it's an in and out procedure and that's all that they do? Find out, why are they recommending that? Number two, how many of these procedures have you done? Experience matters. You don't want somebody to recommend a gastric bypass to you and then find out later that you're one of the first people they've ever done it on. That's a very valid question. It's not something out of the realm of what you as a patient have the right to know. What is the experience level of your surgeon? And how long have they been doing this? I would also ask, what complications do I need to be aware of as a possibility? There are many things that can go wrong, most of them very minor and easily managed. Things like dehydration. Dehydration is the most common complication after any kind of bariatric surgery. Of course, there's always infection. There are a few things that can be bumps in the road. Then there are some things that are mountains in the road that are very, very much less likely. But you need to have your surgeon tell you, what are these things and what do I do if they happen and what can I do to prevent them? There are many things. For example, with the dehydration, I was given instructions on drink, just sips of water, sugar-free popsicles. And despite all of that, I still had dehydration and I had to get IV fluid. So just know, be educated on what can go wrong and what you should do if it does. I would also, this is a big one all of us ask, how much weight should I realistically expect to lose with the procedure that you're recommending? There is basically a formula that your surgeon can use to show you what a realistic weight loss goal is. And if they are telling you you're a candidate for a gastric sleeve and a bypass or a SADI, these are the different amounts of weight that is expected to be lost with each procedure that can guide you towards which procedure is right. Sometimes we as patients go in with unrealistic expectations. And hearing from the surgeon, this is realistic, can give you some guidance in what your true expectations should be. You don't want to set yourself up for failure. Next, I would ask, what is eating going to look like for me after surgery? Ask in that immediate post-op time, what is their plan like? What is their pre-op diet? Some plans have a 2-week liquid diet like I had and a 2-week liquid diet after like I had. Others allow some solid food sooner. Every program tends to be different in that 2 week liquid diet, then transition to soft food, then transition to this. So ask them, what does my post op eating look like? And then I would also ask, what is my lifetime eating going to look like? That's something that is of real concern for most of us. So I think that's a question definitely to ask your surgeon. In your experience, in 5 years, what is my eating going to look like? I would also ask, and this is a big one, if I regain weight after I lose weight, how do you handle that? Do they have a plan for regain? Can they tell me how much regain is natural, how much is expected? If it goes over that, what can you do to help me? Do you have a plan in place? I think a good surgeon should. They should have a team that they can get you in with, that you can deal. I would also ask, and this may be not so much for a pre op question, but in your early follow ups, how much weight, if I regain, should trigger me to seek help? A 5 pound regain maybe doesn't merit an appointment, but maybe a 10 pound does. So that's something you need to clarify with them. I would also, another big one, these are all big ones, how will this surgery affect any medical condition I have? For example, high blood pressure. I had high blood pressure before surgery. My surgeon told me, I feel after surgery you probably won't need blood pressure medicine eventually. A lot of those comorbidities that we have that are weight related, like diabetes, like cholesterol, like hypertension, like sleep apnea, they resolve after surgery. Not overnight, but with time. However, there are some things like certain mental health conditions that you take medication for, that surgery can affect the way that medication is dosed. That will go back to your primary care provider or whoever prescribes that medicine. But your surgeon should know if you're on Effects or XR, for example, that it may not dissolve the way that it needs to. We may have to change you to, instead of one XR pill a day, 2 immediate release pills for you to get the same effect. That's something your surgeon should be able to tell you, and a very important question. I would also ask, what does my follow up look like? What does my long term follow up look like? What do you recommend? Honestly, if you have a surgeon who says to you, well, you come back in a month, you come back in 3 months, you come back in 6 months, you come back in 9 months, you come back in 1 year, then you're done. It's a little shady. Every surgeon that I have ever worked with as a primary care provider wants a yearly check-in. Even at year 10, they want you back in to at least on a yearly basis to make sure everything is going well. So I would talk to your surgeon about, in the immediate post-op era, what does it look like? And a long term, what kind of follow-up should I anticipate? I would also ask, who else will I be seeing on your team? Most surgeons have a nurse practitioner or a PA that handles a lot of their follow-ups. They may have a mental health professional that they want you to see before surgery. They're almost always, if they're an accredited surgery center, they're going to have a dietitian that they want you to see. I had to, with my surgeon, I had to do a pre-op class with a nurse practitioner who kind of educated us about not only the dietitian things, which we had a dietitian for, but some of the other post-op changes that we would see. So ask, who else am I going to see? Who else is there if I need them? Who is my team going to be? And finally, if something goes wrong, who do I call? What is your plan for this? If it's Sunday morning, a week post-op, and I start having abdominal pain, who do I call? If I feel like I'm getting dehydrated the week after surgery, who do I call? and what do you want me to do? So you will, in your mind, even though the chances of something going wrong are very, very small, you need to be educated about that and know what to do. In that immediate post op time, when you're signed out of the hospital after surgery, you probably aren't thinking clearly, even though they give you a stack of instructions. It's better to have that written down and have a plan and know before surgery. Guys, I would love to hear what other questions do you feel like you should ask your surgeon in your pre op appointments? What did you ask that you were surprised at the answer? I would love to hear where you're at in your journey, any problems that you're having. I would also love to hear any suggestions for a video. This was a video suggestion from a viewer. Guys, I hope you have a great week, and I will see you next Wednesday. Bye.